The bottle says magnesium glycinate supports deep sleep, calm, muscles, glucose, and blood pressure. That is a lot for one mineral. If someone buys it mainly because they are tired and wired at night, what is the first claim we should slow down and check?
I would start before sleep, with physiology. Magnesium is an essential mineral used in more than 300 biochemical reactions. It helps normal nerve and muscle function, energy production, protein production, bone strength, heartbeat regulation, immune function, and blood glucose handling. So the honest foundation is strong. The body needs magnesium. The leap is claiming one form reliably fixes every symptom. Mechanistically, magnesium sits close to nerve signaling and muscle contraction because it interacts with ion channels and enzyme systems that use ATP. That can make low magnesium feel like a body-wide problem. Weakness, cramps, abnormal rhythms, tingling, or fatigue in real deficiency. But a mechanism is not proof that a bedtime capsule will sedate a well-nourished person.
So where does glycinate fit? People online talk like magnesium glycinate is the calm version, citrate is the bathroom version, and oxide is the migraine version. Is glycinate special because of glycine, or mostly because it is another way to deliver magnesium?
Glycinate is magnesium bound to glycine. In practice, people often choose it because it may be easier on the gut than some other forms, though individual tolerance varies. The evidence packet does not support saying glycinate itself is a guaranteed sleep medicine. It is more responsible to say, if you need supplemental magnesium and want to avoid diarrhea, glycinate is a reasonable form to discuss or trial.
Let's make the sleep claim concrete. If someone falls asleep at 2 in the morning because of stress, caffeine, and revenge scrolling, is magnesium glycinate likely to be the main lever, or is it more of a small experiment after the obvious levers?
Exactly. Sleep evidence for magnesium is mixed and population dependent. It is most plausible when intake is low, older age or medical context raises deficiency risk, or nighttime symptoms overlap with cramps or restlessness. If the real driver is alcohol, late caffeine, untreated sleep apnea, depression, or a stimulating medication, magnesium may distract from the bigger fix. Baseline context is the biggest filter. Magnesium comes from dark leafy greens, nuts, seeds, legumes, whole grains, soy foods, some fruits, and milk. True deficiency is uncommon, but inadequate intake can happen, and risk is higher with alcohol misuse, gastrointestinal disease or surgery causing malabsorption, older age, and type 2 diabetes. Those are better clues than a random symptom list.
What about blood tests? People hear that serum magnesium can look normal even when magnesium inside cells or bones is not ideal. Does that mean testing is useless, or just that the result has to be interpreted carefully?
Carefully is the right word. For blood pressure, randomized trial literature suggests magnesium can have modest effects in some groups. In one 12-week trial in overweight or obese adults, magnesium glycinate plus vitamin D raised vitamin D status more than vitamin D alone, and people starting with systolic pressure above 132 had a systolic drop around 7.5 millimeters of mercury. That is interesting, not a replacement for hypertension care.
And glucose? Magnesium is involved in glucose metabolism, so the marketing jump is that glycinate improves insulin resistance. But one recent trial with magnesium glycinate plus vitamin D did not improve glucose, insulin, adiponectin, or HOMA-IR over 12 weeks, right?
Yes, and migraine belongs in a separate bucket. The American Migraine Foundation discusses magnesium for prevention, commonly magnesium oxide at 400 to 600 milligrams per day, with the most substantial evidence in people with migraine aura and also data for menstrually related migraine. That does not prove glycinate is the best migraine form, but it shows magnesium has condition-specific evidence.
Muscle cramps are tricky because magnesium is clearly needed for muscle function, and deficiency can cause contractions or cramps. But lots of cramps are from training load, dehydration, pregnancy, medications, nerve issues, or circulation. So magnesium makes most sense when the whole picture suggests low intake or deficiency risk, not every calf twitch.
A practical trial should be boring and measurable. First, improve food sources if possible. If using a supplement, record the elemental magnesium dose, not just capsule weight. Track one target outcome: sleep latency, night waking, cramps per week, or home blood pressure. If nothing changes after a reasonable short trial, do not keep escalating because a video promised transformation. The common safety issue is gastrointestinal: diarrhea, nausea, and cramping, especially as dose rises or with more laxative-like forms. That side effect is not detox, it is a dose-limiting adverse effect. If the supplement is causing bathroom urgency, reduce the dose, stop or reassess the form, rather than treating discomfort as proof it is working.
The kidney warning seems more serious than stomach upset. If kidneys normally clear extra magnesium, then kidney disease changes the whole risk calculation. That is not a casual supplement aisle decision, especially if someone is older, medically complex, or already using magnesium-containing laxatives or antacids.
Timing matters too. Magnesium can reduce absorption of some antibiotics, bisphosphonates, thyroid medication, and other medicines if taken too close together. Anyone on prescription medication should check spacing with a pharmacist or clinician. This is one of those supplements where the mineral is ordinary, but the schedule can make it clinically important. My bottom line? Magnesium glycinate is a reasonable option when the goal is supplemental magnesium with decent tolerability, especially if diet is low or risk is higher. It is not a universal calm switch. Use food first when you can, track a specific outcome, avoid reckless dose escalation, separate it from interacting medicines, and do not self-prescribe with kidney disease.